Good evening, I'm John Bensick, and I'm representing the Veterans, Military and Veterans Affairs. Three things that happened to me just recently. Last night, my wife had our 5-year-old granddaughter come over, and she didn't want me to say anything, and I didn't know much about it, but her student was one of the students that was 5 years old that was killed in Dearborn Heights, Michigan. And this is a very sensitive situation because there's 3 schools nearby, plus I understand one of the residents was a student here in Southfield, Michigan. So we're just going through the tragedy of what happened there. I had an accident happen to me. It took us 20 years to get Military Veterans Affairs in the Michigan Democratic Party. I am a registered delegate and been voted in for my 36th and 37th year. I'm getting ready to move from Dearborn, Michigan to Ann Arbor. I have a farm out there, so I've already notified a year from now I'm going to be in the 7th Congressional District. And I accidentally had to chair our Veterans Affairs caucus. And we had 50 people sign in. And neither one of the presidential candidates was not mentioned whatsoever of all of the people that came in the room. We had many candidates from our party walk in and out, and I understand the same thing has gone on with the Republican Party. And the subject matter came up with the Grand Rapids and the privatization of the home. And I have to admit to you, in all the testimony and all the factual aspects that was brought up this evening is all true, 100%. I really support your summary of the pearls of mental health system privatization. I read it over. I told my wife was coming up here because there's 2 other meetings, but I wanted to get a foot in the door and understand what the subject matter is all about. I spent my whole life in manufacturing as a corporate controller, in manufacturing, accountant, and finance, and had to be responsible for all the health insurance and HMOs. I thought HMOs, when they came out, they were invented and developed in the state of Minnesota, was a lousy insurance organization in the first place. But end of subject matter most tersely is we all have to get out, and we certainly can't allow $2 billion to go into the private sector and cause privatization. There's not going to be any checks and balance system. All the testimony that was brought up here this evening, and I've been in the business aspect of it all my life, is absolutely true. I'm speaking with close to 45 years of working experience. I'm 71 years of age. I just got retired at the end of my 68th year. My first introduction to mental health had to come back when I came back from the Vietnam War with a full bird colonel, worked with OSS, and we drafted doctors and trained them for combat, and only 30% of them could qualify to be on the combat field to even do medical services without coming home or coming back to Conus totally nuts afterwards. And at the installation I was at, I got to see our mental facilities, from officers all the way back from generals to private E1s, and what mental health situation did to people going through war. And then on my 71st birthday, I too am subject and went through a major operation in Henry Ford with cancer. They found me full of it, and so far things are moving in the right direction. And I'm not suffering any depression about it or anything else, because I'm very fortunate that I just really, I look at the positive aspect of the moving forward and taking care of our issues and our problems, and that's why I'm here this evening. The testimony that you all brought up here this evening, I have to say, is extremely very well written, documented, and substantial, and the terminology behind it, and the experiences by some of the altruism. I really enjoyed that part of the story of the lady that brought it here. I too have a son that came back from the military service, and he has major medical issues, and he's also gone through the Beaumont health system right now, and we're still working on him. As for myself, I spent my whole time working with Agent Orange and the effects that that has done in terms of the cancer, and 50% of the guys that went through the Agent Orange, and many of us right now, 50% of us are either in serious health or have passed away, has deeply affected them in terms of the mental health aspect of it. What our governor has done to our home, our veterans home in Grand Rapids, Michigan, is the same thing that John Engler did with the Lafayette Clinic, and I remember that extremely very well, and how the Michigan State Police had to go out there in that freezing afternoon and pick the patients off East Lafayette Avenue and take them to other facilities, and they rolled them right out on the gurneys and left them right out in the middle of the street. The reason why I know that is because I saw it there, and I was a corporate controller in Detroit at the time, and I visited and knew people who were actually involved in that situation. So all our governor is, Governor Snyder, is just a clone of John Engler. Thank you very much.
Good evening. My name is Joe Evans. I too am a member of Vision's Clubhouse like Karan. We have two other members with us. You know, it's been my privilege and honor to work with Karan over the last 18 months or so. And we've worked in orientation, tutoring, and just working together on her lessons. And you know, we're Butch Cassidy and the Sundance Kid. only I'm the Sundance Kid. I'm the sidekick, you know. I follow Karan's lead. I'm concerned about losing, like a lot of our members, the clubhouse. The clubhouse has brought to my life, it's a great gift to me, is a successful career, and I say that at the age of 63 years old. Okay, I've aspired to be a lawyer, a professional photographer, a published author, a teacher or professor, and a grant writer. But my mental health issues got in the way. And I tripped over my own 2 feet. It all crashed and burned at my feet. You know? Well, since being at the clubhouse, my work in advocacy has made my dream of practicing law come true. My writing has been featured on the Vision, CNS, and Oakland County mental health websites and newsletters. My photography has been posted on the Vision, CNS, and FAIR websites, and my photographs are mounted on the wall outside of our director's office. My work in tutoring and mentoring, I find the joy of teaching in my work as tutoring and mentoring. One of our advocacy projects is to write Representative Grimmel a letter, and he was gracious enough to respond, and that letter today is framed outside of our director's office. But that's what the clubhouse has done for me. The clubhouse is a psychosocial rehabilitation program that allows us to reintegrate into society to the greatest extent possible. It's a meritocracy. You get out of it what you put into it, and the more you put into it, the more you get out of it. But we have a broader impact on society. For example, mental illness is the #1 cause of disability worldwide, more than cancer, diabetes, or heart disease. Okay, there are not enough clubhouses for those with mental illness. 90% of all suicides are related to a mental disorder, as we know. We open clubhouses so that people with mental illness can get their lives back. Isolation is not the answer to mental illness. Clubhouses offer a community of hope. Every clubhouse that is open touches as many as 500 lives, and that's according to the Clubhouse International website. Since our members have limited mobility, the discretionary income of our members is invested in our local communities. The lunch programs of the clubhouse provides our members with a guaranteed 1 decent meal a day, relieves pressure on local food banks, and other food services, extends the use of their bridge cards, and reduces the overall cost of the bridge card program because it's a more cost-efficient way of doing it. Each room and board in the Pontiac and Auburn Hills area populated by clubhouse members results in one less example of urban blight and provides one successful small business to the local economy and provides an alternate to hospitalization, incarceration, and homelessness during the daytime hours for pennies on a dollar compared to the alternative. Literally pennies on the dollar. The clubhouse resources represents an investment in our local economy and society in general, and not a cost or a liability. Would we all agree?
Yeah.
Again, I ask you to consider the impact of clubhouses as a psychosocial rehab resources to the local communities that they serve. Thank you.
I'm Mrs. Charlene Riddell, and I'm very glad to be here tonight to speak to our legislators here that have the guts to show up. I thank you very much. You can tell your constituents, I don't think much of them, if they couldn't show their heads to a bunch of weak little old women wearing a cane and has a lot of vision problems. So I don't think they're very, very brave if they can't come up against me. I have been a mental health advocate for a long time because I had an older sister who had early onset mental illness. We didn't know what it was. It was a pink elephant in the living room that nobody talked about. My mother and dad suffered greatly. You can guess I'm in my elder years, so this was a very long time ago. I now have a wonderful son who is 50 and has had the services of community mental health since 1996. He had about 5 years of really hell, and so did we, and finally got under control, and he's been in recovery thanks to people who have been there to help him become independent. I have been a very strong advocate for him, and I have had to come up against Oakland County Community Mental Health, and I'm not afraid to speak to them either, and let them know what's going on, because, you know, when you're busy at a desk and you're in charge of things, you don't know everything, right? What I want to say to you people tonight is better pick your ears up and be listening to all these eloquent people that have spoken so much more than I. I am so glad that I am more the last, because the more I heard from out there, the more I said, hurrah, 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 and what I have to say would only be ditto, ditto, ditto. I helped Joyce Rupp when the Royal Oak would not allow Dreams Unlimited to come into their town. That kind of person, how terrible that would be, that they would have the guts and nerve to come into and live on Catalpa, and they would destroy the unity. My son went there. That was the most wonderful place. They were over there in Oak Park before that, and they had a great place. And like these people from the clubhouses who have spoken tonight, what wonderful opportunities they have. These opportunities will not only disappear, they'll disintegrate. And like one person said, as these layers are disintegrated with privatization, there won't be anything left. And we will not have advocates to be able to come up against HMOs, because by the time they deny a loved one and we appeal, our loved one will either be dead by suicide, walking the streets, or in prison. And you heard about what happens when they go to prison. And you've heard about what the ones that have committed suicide and the lives that they would have had otherwise. I have a letter, and I hope you all get it, and I hope you pass it around and make copies to everyone in the legislature, because I'm keeping my ears peeled. I commend Fred. I commend Mr. Reinstein, and I commend all of the people on that committee, the 120 of them that have come before. And if Governor Snyder and those people can't listen to what's going on in this society, people are going to be judged by the way they have treated their least of others. The most vulnerable society is going to be judged. And we will have a judgment day when the world comes to an end, and I want to know which side of the fence they'll be on. And we'll find that out someday. But in the meantime, we have to do earthly things and find out how to dig into and make changes. Why do they have to put another lane on I-75 for 14 years when we do just fine with what we've got? We've always had build-ups. I have helicopters flying over my house 4 times a day because I live by 75. And so what? It's normal. You think it's going to clear up if they have one more lane? How much money is that costing? But oh no, it's important. They have to have that. Why can't they take care of the people in the clubhouse? Or why can't they have the people with autism have the daycare? My son's services are in very grave danger of being cut. He has been independent. He pays taxes. He votes. He has a little truck. We have helped him. I will make sure that he has things taken care of before I leave this world. But I want to know for those coming in, what about the ones that are starting out now at age 17? What kind of health care will they have? What will happen to them? Please, I beg of you, take this H.R. 295 and flush it down the toilet, and let's listen to some of these people who know what they're doing and move on.
I'm Bob McCreevy. I have a son in the mental health system. When I hear a testimony like that, it tells me that we need to start voting in our own best interests and making some changes, because something is certainly not working for any of us. I have a short experience that I'd like to share with you. My wife and I have testified 2 years in a row in Lansing before the House and the Senate Appropriations Subcommittees. Now, just being in those rooms, if you have any heart at all to you, it would bring you to tears to see. It's like some of what we've shared here tonight and heard testify. I watched a little girl come up on a walker, and she was so handicapped that it took 2 people to help her get out of the walker and sit down before a microphone at a table. And I watched her beg that legislature not to take any more away from her because she could just barely live on what she had. Now, I am sure that by the time we got out of that room over there, they either hit the delete button or the round file with our testimony, and that's how much they really care about us. Now, I've been assured here tonight that this testimony will not be deleted. This is going to be a record that's going to stand, that the legislatures that we have here are going to be able to take this and use this to fight the battle to help us. Now I'll go to my statement that I came up here to make. I have a son in the community mental health system. He has lived independently for 30 years. Due to budget cuts from Lansing, he is back in our home. Governor Snyder and the legislature are hurting the disabled. My son was in a portable supports shared apartment program with a 90% success rate. He was stable beyond all expectations for 12 years. He received treatment costing about $1,800 per year and enjoyed a $4,200 per year housing subsidy. Budget cuts for Lansing closed the perfect program, dumped 30 clients to the street. Why would you close a perfect program that saves money? Our son is now being treated in the revolving door of court-ordered commitments and premature releases. The 3rd time this year he was hospitalized, he was so sick both mentally and physically that he almost died. Closing a portable supports program, which treated our son for $1,800 a year versus $180,000 a year in court-ordered hospitalization, sounds like we need a CPA that can add. Where is the savings? Governor Snyder's budget plan cut the budget to community mental health. The plan was cause it to fail, use the plan failure for an excuse to privatize, integrate mental health funds. Budget cuts hurt our mentally ill son. The result of Governor Snyder's budget cuts. Our son lost affordable housing, a $4,200 per year housing subsidy. He is back in our home after 30 years, which the counselors 30 years ago said you gotta use tough love, push him out, make him live independently so he can survive after we're dead. Closed the perfect program, dumped 30 people to the streets. We lost CLR's workers, community living support, lost transportation. He was denied treatment at one point to where he decomped 75% below his baseline. They just ignored him. Stayed away from him for 3 months and never went near him. What we are doing is creating more hopelessly homeless people. Governor Snyder's plan to privatize, integrate the $2.2 billion mental health budget. The plan is cut 40% off the top, turn the remainder over to private industry, the insurance companies that take their cut, which I heard here tonight was maybe another 20 or 30%. That's not leaving much of a $2.2 billion budget. This is an illusion of progress, a crisis in the making, another money grab that will close the doors to community mental health as we know it today. I am afraid to die, leave my son in a broken mental health system, a system designed to fail. I am afraid to die and leave my son at the mercy of 5 insurance companies that are nothing but profit driven.
Hello, my name is Dave Bennett. I was a hopeless living in homeless shelters. I was referred to CNS and started seeing a doctor on a regular basis and was able to find the right meds to help my mind slow down so I can begin to think clearly. I was assigned a wonderful case manager who linked me to Visions Clubhouse. While at Visions Clubhouse, I started to volunteer in the kitchen. The more I volunteered, my self-confidence grew. Through this, I have been able to socialize and make new friends with the support of the clubhouse. I was able to become my own payee again and find my own place. I am able to have a garden again, cook for myself, enjoy society activities. And the best part, I feel that I can start doing what I truly love and skilled at, is making custom carpet mats again. Now I have sense of belonging and a peace of mind. Thank you for listening.
Hello, my name is Barbara Fuller, and I am from Frames Unlimited Clubhouse through Easter Seals, and I would like to read this to you, not all of it, but just part of it. I am writing to you with my personal concerns about the future of the continuation of quality of my mental health services. I have been part of the Oakland County Community Mental Health Authority system for approximately 30 years. Throughout my life, I have suffered from mental illness. I've been depressed most of my life, and I am just bringing myself up from that right now. My greatest fear is that I will begin to become suicidal once again without the support provided by community mental health, and that I will lose my house and currently receive public financial assistance through Medicare and have a spend down deductible that I must reach before my mental health services are paid for. As of October 3rd, 2016, I will no longer qualify for CMH services and had no way of reaching my spend out and have to pay out of pocket for many things that I cannot afford and things that food stamps are currently paying for. Since I just turned 65 this year, I no longer qualify for the Freedom to Work Medicaid program and don't have that as an option in order to continue to receive Medicaid. To me, this is another closed door for me getting the desperate help that I need. I feel like my world is crumbling, or collapsing, I'm sorry, and that I will once again become suicidal and end up homeless. Clubhouse services have played a great role in helping me to stay out of the hospital. If I am no longer able to attend and have a constructive way to structure my life, I'm sorry. I know that I will become more and more depressed and end up back in the psychiatric hospital. This is my story, but I know that there are many others with a similar story, so I beg you to reconsider, one, to properly fund mental health services, and two, to oppose Lansing's effort to shift Medicaid funds to mental health services to provide HMOs where the focus will be on profits first and not my mental health needs.
Good evening. My name is Kathy Bennett, and it's a pleasure to be here. Sitting in the background here tonight and listening to other people's stories kind of made me wonder, should I talk about me? Well, I'll make it short and sweet. I don't have a written speech, so I'll just do it on the fly. I came to this country from Canada over 30 years ago with the promise that America itself is a great nation, that it takes care of its own. And then I start to wonder about boilerplate. And I think, how can the state of Michigan possibly do this to the most vulnerable part of society? Most people that are mentally ill are poor. So what do? How are they going to afford this privatization of HMO and private insurance? We all know reality slaps us in the face. Hey, it's going to go up. You have the high deductible. And I have to tell you, I have been a licensed practical nurse for 23 years, and I do suffer from mental illness. And I can remember the John Engler days, okay? When they started shutting down Fairlawn. That was a $2 billion facility for adolescents that were mentally ill. They started shutting down different mental health facilities. And it was remarkable. They shipped them into long-term care facilities, and guess who had to take care of them? The licensed practical nurse, the RN. They didn't have a lot of experience dealing with people with mental illness. I was fortunate. I had a lot of experience with mental illness. My mother was schizophrenic. Okay, we had to deal with that. And going to school, I made it my duty to learn as much as I could about mental illness so that I could help these individuals that had these problems. And I had a mental setback, and thank God for Easter seals. If it wasn't for them, I don't know what would have become of my life. I had a caseworker who helped me transition through the whole mental health care system. Thank God for OCCHMA, Willie Brooks. What would we do without that particular organization? We would be lost. And Clubhouse, Dreams Unlimited. I have to tell you something from personal experience. I have seen people go into that clubhouse with such severe mental illnesses and go forward, push forward in that clubhouse because they learn how to deal with individuals. But the whole crux of the matter is this, okay? Do not allow history to repeat itself. When you go to Lansing and when you go before the legislature and you state your case, remember that you have on your shoulders and on your head and on your conscience every single mentally ill person, disadvantaged, handicapped individual in your area of representation. And remember, people have power. They can make change. Do not allow history to repeat itself, because a nation who does not take care of the most vulnerable people, what kind of nation are they? What kind of people are we? What kind of state are we? And I can promise you this, okay? This I can promise you, because I worked in corrections. I was one of the nurses that had to deal with the people with behavioral problems, okay, because they became poor, they became despondent. Mental illness crept in there like a specter of darkness. They committed untoward, deviant behavior. They were incarcerated. They come out. They have to have mental health services. They can't get jobs because they have felonies or misdemeanors. It's going to be a big plethora of chaos. We have enough untoward, deviant, dysfunctional behavior going on in our society now. Detroit, today, with the man who just got convicted of murdering his two stepchildren and his own biological children. Okay? These are the things you're going to have to remember when you go in there. Okay? I understand you got to deal with facts, figures, money this, money that. But remember this. The money you spend to privatize, to HMOs, that quite frankly, you know, those people in those private industries, they don't really cut the bait like Willie Brooks does at OCCHMA.
Don't bring it too close.
So these are the things you're going to have to think about. You better think about your conscience. You better think about what's going to happen in society if you don't make the right choice. Will you set the example? Will you be the forerunner? Will you be the sentinel of the most vulnerable people in the state? And show us and show the world that we do care about our most vulnerable. And I thank you for your time.
Hi, my name is Carolyn Gamicia, and I'm here with our son. Do you want to introduce yourself?
Hello, I'm Nicholas Gamicia. I'm Disney's biggest fan.
We're here because we're actually from Macomb County, but we've been receiving services. Our son's been receiving services through the Children's Medicaid waiver and then the HAB waiver now for over 20 years. And the reason I came today is because I'm going to miss the Macomb County session next week, because we're actually traveling out of state because we're thinking of moving because of the decrease in the quality of services over the last 5 years in the Tri-County area in Michigan. And we hate to do that. We've lived here all our lives. We believe that Michigan had the gold standard for Medicaid services through the community mental health program in this country. As an advocate, I worked to establish those services and worked to close institutions in the state when my brother died in Walter Reuther Hospital in 1999 from a restraint death. And he had epilepsy. That was the only reason he was in that facility. So I really would like to say, and I thank you all for being here, but I also want to talk to the people and the advocates and the individuals, not only clients of the mental health system in Michigan, but parents and advocates and service providers that are here today and agency organization representatives. We are 20% of the population in this country. People with disabilities can turn this election. So we elect the people that are sitting here. And I really would encourage you all to talk to your representatives and work with your representatives and see where they get their funding from to fund their political campaigns. And actually to volunteer to assist those that will support you and vote to support your loved ones. Because if we don't do that, then that's our deficit. I've heard heartbreaking stories today. I was a police officer for 21 years. I authored, through a community mental health grant, the training that was delivered in Oakland County to law enforcement and corrections officers through a community mental health grant. I authored that 10 years ago. This county, Oakland County, is probably one of the forefront mental health departments in the country. We presented that program across the country through JAWS trainings and Department of Justice trainings, and it still is the gold standard. And it really, really frustrates me to see the cuts that have transpired in the last 5 years in the Tri-County area. We're not even mentioning that, and we're facing privatization, which would take choice away from those, like my son, who has self-determination. He hires his own staff. It broke my heart when I heard about the other woman that talked about her son with autism, who is 17, and she's had to institutionalize him or hospitalize him several times. That would have been our son if he had not gotten the services through choice and through voucher system in Macomb County and in the state of Michigan. He stands before you today as a college graduate who's made the dean's list. We were told when he was given his diagnosis he would have to be institutionalized before the age of 10. That didn't happen. He's proved the system wrong, but he's proved it wrong with the help of the community mental health programs that in the state were good. And now in Macomb County, we've had almost 100 people in the last month cut CLS services that provided them health and safety to stay in their own homes. Over 100 people have lost those CLS hours and are going to Medicaid fair waiver hearings, and most likely will not get those hours back. Since we've been in the program and since our son has benefited from it, it's been cut, the general funds have been cut. We have sustained severe cuts to our mental health providers in the state, and that's done because of the appropriations and what's transpired by the votes of our legislators. So as I said, we are 20% of the population in the state. In the last presidential election, there was 21% of the registered voters that showed up. If we show up, if we support those candidates that support us, we can have legislators that will represent our children and us and those with disabilities in the state of Michigan. And then I won't have to move. And I'd love to stay here. Yeah. So what I would like to do is ask each of you to make sure within social media that you tell the stories you told today. I want you to use the hashtag, and I know a lot of you, believe me, I am not a social media person, but the hashtag that we're using is hashtag people, the letter B, the number 4, profit, because this is about people. It's not about profit. It's not about privatization. And we will vote for the people that support us. And I'm going to be looking at your voting records. Never mind, you don't know now. And I want to thank you because you took the time to be here, which shows you care. And I'm not calling you out, but I will say, we are the ones that can elect the people that represent us. We have that power. And one last thing I want to say. It broke my heart when I heard from parents that had their children incarcerated. In this country, Rikers Island, the Cook County Jail, and the Los Angeles County Jail are the 3 largest psychiatric facilities in this country. People are being imprisoned and not provided services. And a lot of times, they've not even committed the crimes to be sent to prison. We have a debtor's prison system that is victimizing individuals with disabilities. And I have to say that, and I'm sorry. But I want to thank everybody for being here because it's an important thing. And I will write a statement for our meeting in Macomb. I also serve on the Citizens Advisory Citizens Advisory Committee in Macomb because I think it's important that we are involved within changing the system. Everyone that's here has done it today. And I want to thank you all. Thanks.
Thank you.
I like doing the concept artists like Mara Blair and Walter Paragoy, and the storyboard artists like Bill Pitt and Joe Ramft. Thank you for all for coming.
And who did you vote for president last time?
I'll vote for Donald Trump.
Oh no, I don't know. I don't know about that. I did not influence that at all.
I vote for
Hillary Clinton.
There you go.
Donald Trump, I hope.
No political.
We still have 12 cards, but it's 9:30, and anyone who hasn't been called is a really burning, oh, yeah, I hope you leave a copy of that, desire to come up and speak. We will certainly listen, but I know that we have some folks who have to travel a ways. So if not, Fred, do you want to close us out?
Wait, I just want to...
Okay, sure.
Quickly.
No, that's fine. We're delighted we had this many people.
Hi, my name is Julian Wainwright. I'm a parent of this 24-year-old. Please stand up. Stand up. This is Aislinn. We're talking about healthcare and so on, and HMOs. This is the current predicament we have. We got word that the HMO, for whatever reason, kicked our primary care physician off the list. My daughter started having seizures 5 years ago. She's on a medication called Keppra. We can't follow the script because it's taken them over a week and they haven't rectified the problem. So when you want to hand over the decision making to HMOs, it's insanity. Because what the lady in the doctor's office told us is this sometimes and often happens. We don't know why, they just kick them off. You know what they did? They denied the primary care physician we have, and they assigned us some primary care physician in Petoskey. So what the heck does that help? The bottom line is, you know, there's an anxiety that every one of us as parents with special needs, people with challenges have. You just don't know. It's tough enough dealing with trying to help your child or your brother or your parent, whatever it is. You cannot add to that. As Carolyn said, you know, we have to use the power of our vote, and we will do so. But it still comes down to you guys who are in the legislature, and you have to look in the mirror. And that's why I asked you, stand up, Aislinn. Just stand. Stand up, sweetheart. Stand up, sweetheart. Come. You have to look at that face. And if your vote denies her, it's on you. It's on you. And she's not alone. There are plenty of people like her. So that's what I want to say to you. Think and vote and be smart. These are people. These are not figures. It's not the money. There is money. It's how it's used. So you as the decision makers have the power.
Hi, I'm not good at speaking, but I gotta get up here.
My name's Sandy Martin, and I go to Easter Seals. And I've heard that
my case manager is gonna be taken away from me. I'm considered one of the high functional ones, and if I can't handle doing it, how can other people? This really just pisses me off. For one, this Snyder's not here, he don't have no balls about it. They're gonna take my Medicaid away from me. I need a hip replacement, a knee replacement. I make $1,024 a month. And I gotta pay 20% of that out of my money, so I can have my hip replaced and my knee replaced. It's like, be for real. I mean, you guys better be glad I'm in church now, because I wouldn't be talking this good. I have a case manager, she's gonna be taken away from me. And it's like she's the one who organizes my life. If it wasn't for her, I don't know where I would be. Thank God, I'm sorry for Flint and their water problems, but I think it's been held off this long because of the water problem in Flint, because Snyder had to take care of that business, you know. I mean, I have felt like jumping off of a bridge, and I'm sure many other people will want to feel that same way if their benefits are being taken from them. That's really all I gotta say, but it's just like, please go out and vote, and I mean, listen to the people that are mentally ill. You know, I mean, like I said, I'm one of the high functioning ones, but it's like, if I didn't have my case manager, I don't know what I'm gonna do. And she's gonna be taken away this month. My psychiatrist has already been taken away from me. At Easter Seals, it's like, what's the point? What is the point? Thank you.
Thank you. All right, well, I think that does it for us tonight. Keep in mind that if you still have things you want to say in a forum like this, there's 2 more meetings in Macomb and Wayne County, which are on the flyer. Hopefully all of you, those that have talked and those that haven't, have submitted some written testimony. If you haven't submitted it by, the flyer has my email address on it, you can send it to that, or you can send it to, mail to Lions Group Mentally Ill, Oakland County on Southfield Road. And we will make copies of it and see the legislators see it. So this has been very good. I think we've had some good stories and some good communication here. And I hope that, that you guys can take this back to your peers and help them understand what we all go through as parents and people who care for. It's a serious problem. Thank you very much, all of you, for coming.
Thank you.